Hi, my name is Aaron Bodette, and I run a small organization, pretty much just me, called MedicarePrepare.com. You can find me on Facebook, what have you. I am here to help educate you, inform you on a variety of Medicare health plan topics so that you can make informed decisions. And this video is my synopsis of how to find the best considerations for a Part D drug plan for you. A lot of people will say, "Oh, my friend has this plan, and it says it works great." Well, that doesn't mean it's going to work great for you. Hence, I put together this instructional tutorial video on how to locate the most suitable, considerations for you. Here's what this video is not. This is not a tutorial on how Part D drug plans work. I'm not going into the details and the mechanics of how they work. I will do that at a later time. This is the end result. This is how you should do your research or have somebody do it for you. And any agent who's worth a pound of salt will know that this is the way you find drug plans. It's on the Medicare.gov website. So if you're looking for an explanation of how Medicare Part D drug plans work, this is not the video. You want to find efficiency in dollars, in cents. This is the right video to watch. Okay, thanks for your time. See you soon. Okay, I am going to show you the best way to find and locate suitable Part D drug plans for you. I'm not going to explain how Part D drug plans work on this video. I am merely going to show you how to find drug plans that may be the most attractive for considerations. Medicare.gov has done all this work for us. So go to this website, Medicare.gov, and when you get there, click this button, Find Health and Drug Plans. Put in your zip code. I'm just going to put my zip code in and press Find Plans. On this page, I'm going to put in Original Medicare. You can look through these if you'd like, but I think you should put in Original Medicare. Put in I don't know, unless you are getting extra help or you have Medicaid. And then put in yes, I want to add drugs. Continue to plan results, and here you're going to enter your drugs. I'm going to put in a few drugs like losartan. I'm going to use the default quantities and dosages. You can change them to make sure that they meet your needs. Then it populates down below. You can change it, remove it, add. You can do a lot of things. I'm going to put in simvastatin. This is also another popular drug, and I'm going to put in some drugs that a lot of people take. Metformin, this is a pretty common drug, and you can see there's a lot of defaults for dosages and whatnot. And once you have all your drugs in there, why then I'm going to put in this one here, glipizide. This is a drug that I see often as well. Once you have all your drugs in here, you say, okay, my drug list is complete. Now you're going to select pharmacies. There's only two pharmacies within 3 miles of here, so I'm going to put in 15 miles. This is going to open up new pharmacies. I'm going to add CVS, and I'm going to add probably Walmart. Yes, Walmart. Okay, so you can only select 2 at a time. However, you can come back here and change the pharmacies to see if there may be some better results. Now you're going to click Continue to Plan Results. And on this screen, you're going to pick prescription drug plans. These are Part D plans. You can see there's 23 plans available that are Part D only. Continue to Plan Results. So here, if you scroll down, this is if you just paid for the drugs under Original Medicare, $2,300.10 a year. This is what is retail cost. However, if you come down here, you'll see this is where the prescription plans start. There's 23 plans found. I'm going to view all the plans. So this is where it gets cool. Medicare has done all the work for us. They have taken the premiums. They have taken the copays, the catastrophic. They've considered the gap and the deductibles. They put it all in one place. And they are listed in order of cost. You can see that this plan, if you had that combination of drugs, would cost you $155 a year. Conversely, if you go down to the end of this, the last one will be the most expensive. It would be $1,146 per year you would pay for the same set of drugs. at those pharmacies. This is why I like this tool. So clearly, it would be prudent to select a plan near the top of this list. Find a company that you're either comfortable with, familiar with, that has good ratings. Maybe a friend has it, and see what you like. And you can go deeper into it and just click this button, and then it will show you exactly what your copays look like. Oh, look at this. So if you go to CVS, it'll cost you $171 a year. If you go to Walmart, it's going to cost you almost $700. If you do mail order, it's going to cost you the same. So this is going to show you the actual cost of the drugs, what you'll pay in the deductible phase, what you'll pay in the copay phase or the initial coverage phase, the gap, and catastrophic. You're going to pay very little for these drugs. I like this, the way this Medicare has this set up. It's pretty cool. So just be aware that this is a very inexpensive combination of drugs. If you went back into drugs and you entered something that was a little different, I'm going to add a Humalog. This is something that is used for diabetes. Now things are going to change because this is an expensive drug. I'm going to go back through my list as complete. I'm going to use the same pharmacies, and now I am going to look at the 23 drug plans, and these drug plans are probably going to scramble. Going to be a different plan at the top because the drugs are different. If you go with this plan, it costs you $1,285 a year. If you go down to the bottom, it's going to cost you $7,200 a year. That's a $500 a month difference. I see people make this mistake all the time. They don't understand why their drug costs are so high. This is why. They haven't selected the right plan based on their individual circumstances. Now, just because a plan is at the top of this list and the least expensive, that doesn't mean you should have it. I mean, look at the star ratings. And then keep going down, and talk to some friends and decide, hey, if this plan has a 3 out of 5 star and it's 1656 and this plan has a 2 star, well, you know what? Maybe you'll go for this plan. Hey, maybe you'll just go for this plan. I'm not condoning any one plan over the other. I'm merely trying to show you how to find the least expensive solution because Medicare, as I said, has taken into consideration the premium of the Part D plan, the deductible of the Part D plan, the co-pays, and what you're going to pay in both the catastrophic and in the coverage gap phase. And on this one, clearly you can see Walmart is actually a little cheaper. So down here, I'm going to click the Walmart tab. It's showing me the retail cost of these drugs. You can see the Humalog is an expensive one. But look what you're going to pay for this drug. And you're going to pay $20 a month, $20.78. And the deductible, in the copay phase as well. In the coverage gap, you're going to pay more. In the catastrophic, you're going to pay more than you would here. Again, I'm not here right now to explain how these drug plans work. I'm merely trying to show you how to find the least expensive or some of the lower cost ones for you, given your set of circumstances. And this is a graphic representation of what you pay by the month. It's showing me what your premium is and what you're paying in the deductible. You're going to pay $80 a month until September, where you're going to pay. You're going to be in the gap, and you're going to pay a little bit more. But this is a really great technique for finding low-cost programs. You can copy and save or take a picture of this and save your drug list ID and your password date, and then you can get back into the screen at a later date because it will expire, within 10 or 15 minutes. You can go back in to select your pharmacies, and you can change your pharmacies. So you can remove CVS, remove Walmart, and I'm going to go to a local pharmacy. I'm going to add Boyceville, and then I'll go to Rite Aid. So I'll compare these two, and then I'm going to go back through to the end of this where I can see what the Part D plans will cost at those pharmacies on this set of drugs. And again, we're in about the same ballpark. It didn't change much. But this, I see this all the time. I see people who are spending, it didn't go that high. If I view all the plans, I'll see the ones that are, least corresponding to this set of drugs. I see people spending $6,000 and $7,000 a year on drugs, when if they had a plan that was more suitable, in my opinion, they'd be spending $1,300 or $1,200. This is how you find good ideas for your drug plans. So just be aware of that, and if I can help, reach out to me. I'm good at this. If I go back and enter the drugs, and I put in a real heavy drug, which I see on occasion, this drug here, this Enbrel, this is a serious drug, and you'll see this will change a lot of things. Got it in there, keeping the same pharmacies. Not going to change that right now. And I'm going to look at all these Part D drug plans again. And let's see what we come up with. I'm going to look at all the plans. Now, this is a serious drug. Look, if you don't have coverage, you'll probably pay about $71,000. If you have this plan, you'll probably pay about a little under $5,000. If you go down to the bottom of this list, you can see the cost is $69,000. Why? They're probably not covering Enbrel. Not all drug plans cover every drug. They have to cover at least 2 drugs for every condition. But that particular drug was not covered by that plan. And if I go back down there, to any of these plans, you'll see if I click this particular plan. It doesn't mean this is a bad plan. It just means it's not suited to your needs. You can clearly see that this Enbrel is $6,200 a month, and it's not covered because it's the same price in the deductible, copay, gap, and catastrophic phase. So this would not be a good choice, in my opinion, for somebody who met this criteria, especially if they didn't have, if they had extra help, maybe it would be different, but probably not. It has to be covered by your drug plan. Or I would also consider a state pharmaceutical assistance program. They vary by state, but if you need help, reach out to me. I can certainly help point you in the right direction, whether I have the solution or not. Okay, so I put together a little bonus video for you because this is important. These are things that you should know. As we can see, the least expensive plan appears to be this plan for this set of drugs at a cost of $4,803 for the remainder of the year. The most expensive plan, it appears to be this one at a cost of over $62,000. Obviously, this would not be a strong consideration in my opinion. However, there's a program that you should know about. There's many programs available through the government and the state, feds both, and one of them is called Extra Help. Maybe you've heard of it. It's synonymous with the term or the phrase low income subsidy. And if you can qualify for that, I want to show you what happens here. I'm going to go back into the beginning here, enter my information, and I am going to say that, hey, we applied for and we got extra help, and we pay these copays. Now I'm going to go back through this software, and all my drugs are saved. I am going to pull up the plans that now assume that I have extra help. And I want to show you what this does to your overall cost here. I'm going to look at all the plans that are available in this market, and I can see that this particular plan, look what happened to the price. Bang, went from $4,800 to $43. The plans that are most expensive, only because of the set of drugs that you're taking, didn't change much, as I said, because that drug Enbrel is not covered by this plan. This is important to know. There are a lot of programs that you may qualify for that can help you. This is one of them. I'm not an expert at extra help or low income subsidy. However, I wanted to point out that I went to the Social Security website and I did pull up some information in the way they talk about what is extra help. So you have 2 criteria: resources. How much money do you have? And income. What's your income like? And I think that the limitations are pretty broad here. You have to have resources if you're single of no more than $14,390 for 2019. Married, $28,720. There are a lot of things that do count, like real estate, other than your primary residence, and there's a lot of things that don't count. What are the income thresholds? Well, they're here. Single, $18,210 for an individual. Married, $24,690. These are pretty liberal in my opinion. As I say, I am not an expert here, but I'm just merely making you aware of this. Here's how you apply. You can call Social Security. You can go online to Social Security. You can go to your Social Security office. You can go to the Office of the Aging. You can grab the application right here online. If you think you may qualify, even if you think you're close, I would urge you to consider applying for this. There are also state pharmaceutical assistance programs. Some of them are much more liberal on income and assets than this, certainly in New York. In New York, they don't ask about assets, they ask about income, and the threshold is $100,000 married and $75,000 individual. Those are extremely liberal. I had in other states they're much more restrictive. But as I say, this is just a little bonus video that I wanted to put together. Just because, as I said, this plan is the least expensive, it doesn't mean it's the one that you should get. You have to decide a number of other factors. Maybe talk to your pharmacist or look at the ratings or ask some friends. But as you can see, the costs are considerably lower when you add in extra help or low-income subsidy, and there's a variety of levels of that. I've used the most extreme level here, where you're going to pay very little copays for your drugs. Here's where the jump is: $538 to $5,700. If you go here, there's something that is not covered very well. But if we go into here and we look at what the anticipated copays are, this $5,000 drug becomes $850. This $567 drug becomes $850. So these are things you have to know. Your insurance agent has to know this. He has to be able to guide you. If we go into this plan here, and again, doesn't mean this is a bad plan. It just means it doesn't fit for the set of drugs that you're taking. This drug becomes $850. This one is not covered. This is why the cost is so high, because this one is not in the Part D drug plan. That would not be a strong consideration in my opinion. And of course, if we go down to the bottom, to the very last one, probably neither of those drugs are in the plan and covered. And we can see, yes, this one's not covered, nor is this one. That's why we get to this copay. All right, that's how you find the right Part D drug plan, in my opinion.